Hey everyone, welcome back to my channel. If you're new here, my name is Kayla and I am here today to help you pass your NCCT for your phlebotomy exam. So this is stuff that I have learned over the years. I have been a phlebotomist for about 14 years now. I have been in healthcare for longer than that, and I have a series going on and once a week where I talk about my experiences. It's a get ready with me, talking about from A to Z, from everything that I've learned up until this point and what led me into being a phlebotomy instructor. I've been a phlebotomy instructor since 2015, and yeah, so I have lots of experience. I've worked in hospitals, I've worked in outpatient clinics, I have worked mobile, I have done it all, and I have done temp jobs, I've done permanent jobs, I've even worked as EKG techs, telemetry techs, the whole 9 yards. So I know as much as you could probably know about all of these subjects. Anyway, just a short introduction. If you're new here, this is episode 2 for chapter 2 in this book right here, the complete textbook of phlebotomy, the 4th edition. So this is from one of my first positions as a teacher, but I have a ton more that I'm going to share with you guys. So you're going to get it from all aspects from this book, and I have another book as well. So 2 of the places that I worked at did this book, and then another place did a completely different book. So those will be 2 different series from 2 different books. Just wanted to let you know that ahead of time. So if you wanted to get 2 different perspectives, you will see that eventually. It's going to take me time to get to that point. So here we go. So now we are going to be talking about the next 3 subjects that are really important for safety in phlebotomy. And so that's what chapter 2 covers, is all safety. So we're going to explain the infection concept, which if you watched my last video for this chapter 2, you'll hear the concepts behind infection control. We're also going to be able to explain differences between disease-specific category and category-specific isolation. We're going to list 3 types of transmission-based precautions, and I'm going to try to also get in there with the explain the purpose and scope of standard precautions. Another means for the universal precautions is your vaccinations. You only need bloodborne pathogen specific vaccines to protect you from working as a phlebotomist. The main one being your Hepatitis B vaccine, okay? So where universal precautions started, they were developed by the CDC as a response to increase in AIDS and Hepatitis B bloodborne pathogens and diseases. Any patient has the potential to be infected with these bloodborne pathogens. Universal precautions assume that all blood and most body fluids are potentially infectious. Because it is impossible to know if a patient is infectious, the healthcare worker must treat all patients with universal precaution infection. So that's just a little on where universal precautions came from. Next are going to be your source. So there are all different types of sources that can lead to you being infected or spreading an infection. So as a phlebotomist, we work in the lab, especially if you're working as an inpatient phlebotomist, you're working directly in the lab on a daily basis. So you are around not only bloodborne pathogens, but you are around all types of fluid pathogens, okay? Anything you could imagine is there. So we're going to talk about your body fluids and the types of their sources, okay? So your first one is going to be the amniotic fluid. That's the fluid that surrounds an unborn child. Your pleural fluid is going to be the fluid from your lungs. Your peritoneal fluid is the fluid from the abdominal area. And your admetus fluid is going to be the buildup of fluid in the body tissues. So if you see a patient that has swollen limbs, that's what that is. Pericardial fluid is the fluid surrounding the heart. Synovial fluid is fluid from the joints. And cerebrospinal fluid is fluid from the spinal column. Every single one of those are considered bloodborne pathogens or spreading type pathogens. So that's just something to keep in mind, that these things can also spread those infectious diseases as well. Okay. So reducing your exposure risks, you can use engineering controls, which are these. Engineering controls are controls that isolate or remove bloodborne pathogens hazard from the workplace. Work practice, those are where you are following your specific guidelines that each hospital or facility has set in line for you to keep you safe. Housekeeping, you can utilize housekeeping because they can come and clean up anything that you need, especially if you drop something or it spills on the floor. Utilize them to the best of your ability if you have an issue with that. Your hepatitis B, again, like I said, the vaccination for that, most of us get that when we're kids, so we get just a blood test for that. You don't have to get it again if you already have the antibodies for it. Private isolation rooms, so those rooms are to help prevent different diseases such as MRSA, gout, and tuberculosis is another one that can be spread if they're not in an isolation room as well. And of course, your personal protective equipment, that is the equipment that you use to protect yourself from any bloodborne pathogens. So that would be your gloves, your face mask now, and washing your hands, as well as wearing a gown if it is necessary. Another thing that we use is safety bags for biohazard bags and your puncture-proof containers for the needles. So this is what these look like right here. These are your biohazard bags, and these are your safety puncture-proof containers for our needles. So when we're done using the needles, you want to make sure you activate your safety, and we'll talk about that a little bit later. And you're going to want to make sure that you put your blood into these biohazard bags when transporting, because we don't want anything to happen, because if they do fall or something happens to them, they will be in a safe place that keeps the biohazard from spreading and getting everywhere. Another thing that we use to help prevent any susceptible diseases or anything happening to our patient when we're drawing blood is we use antiseptics to help clean the site when we're drawing blood. So your first one is going to be 70% isopropyl alcohol. Your next one is going to be iodine, 2% chlorhexidine, chloride. That's an alternate. That's not something that you would directly use. The first one you would choose is going to be your 70% isopropyl alcohol. Zephyrin chloride, that's also an alternative. And your hydrogen peroxide, and that's an alternative. Those are not your first. They all go in order of what you would use, okay? So when you are first becoming a phlebotomist, you want to make sure that the gloves that you're choosing are going to be fitting correctly on your hands. So I wear a size small, but that's just because they fit me tight. I could wear a size medium if I wanted to, but it's going to make it more uncomfortable. The tighter your gloves are, the more comfortable it's going to be, and the easier you're going to be able to feel for or palpate for the vein. And it's just going to be a lot less risky when handling your items. So that's also another thing to keep in mind when you are thinking of your standard precautions for yourself. So you want to remember your personal protective equipments. These are used by phlebotomists, and this is just a repeat of what I've already said. They include masks, goggles, gloves, gowns, face shields, and this equipment is used to protect a phlebotomist from any infectious materials that they're handling. I'll also be going over the way that we remove gloves in probably the next part of this chapter. I will go ahead and grab some gloves and show you directly how to remove gloves so that you have an idea of the way that they need to be removed if you are new to this or you didn't learn the proper technique while you were in school. All right, so that is it for this specific part of the chapter. I'm going to go more in depth on different types of isolations and what you need to do to protect yourself when going in those types of isolations in the next part of chapter 2. So I hope you guys got some information from that, and I really appreciate your time and energy that you give me. And if you have any questions, please leave them below down in the comments, and I will be gladly to help and answer them. So again, thank you guys for watching. Like and subscribe if you are new here, and keep an eye out for the next part of chapter 2, which is going to be part 3 coming up next. So see you guys later. Bye.